Hey guys, Dr. Lee here from Head to Toe Spine and Sports Therapy. Just want to go over some sciatica pain here. We've been seeing that a lot in the clinic, and there's a lot of misconceptions, a lot of people that are misinformed on that. They think anything in the back is going to be a sciatica pain or anything down the back of the leg. But I'm just going to tell you a little bit more about it so you can actually figure it out for yourself and potentially go get it fixed. So, sciatic nerves. So sciatic nerve is one big nerve. It's about the thickness of like our index finger or our middle finger. It's very thick, and it's a coalition of all these nerves in our lumbar spine here. These are our lumbar vertebra for our low back. So there's 5 nerves here, and they all come into one plexus before they turn into one big nerve that goes down through the pelvis here and under this sciatic notch. So with this, we see this is going to bring us to the first spot where we get a lot of impingement. So whether that is right in the back itself or right where the nerve exits from the pelvis, these two spots tend to be the number one areas where we have compression of the nerve, which is ultimately going to give us that nervy pain. So the nerve pain you're going to feel, like some people it's different. So the sciatic nerve going all the way through this notch, down the back of the leg, all the way to the bottom of the foot. So a typical sciatic pain, a very textbook pain would be pain on the bottom of the heel, like a sharp shooting, like lightning-like pain down the back of the leg. So that's not the only way that we get that pain. Nerve pain can be anything, tingling, burning, numbness. So if we're getting any back of the leg burning, if we're feeling a really achy pain in the top of our calf, that's gonna be the sciatic nerve that's causing that pain. But at the end of the day, it's not a textbook version of sciatica. So sciatica being the condition that's affecting the sciatic nerve. So the sciatic nerve being this big guy in the back of the leg governs our sensation of our skin. It tells our muscles what to do. It tells all the nerves, arteries, veins what to do. It's just ultimately going to connect everything and help it communicate more efficiently. So if we have another thing that's going to happen with this sciatic nerve, if we're not getting the full down the back of the leg type sensation, which is generally from a compression of the lumbar spine, we can have what we call a double crush injury, where there's 2 points of compression. Could be that one's in the spine, one's at the sciatic notch. Could be that there's a really tight muscle in our hamstring. Maybe we had an old hamstring injury at some point, and that scar tissue has proliferated to the point where it's compressing the nerve. Regardless, what we're going to do in the office, we're going to decrease the stress around the nerve. So that's going to come in 3 different ways. That's going to be from us manipulating the joints, giving you chiropractic care, some adjustments in there, probably for the lumbar spine and as well as the pelvic complex here. Generally speaking, when we have sciatic issues, we don't externally rotate this pelvis, so we don't rotate it backwards. And when we walk, that's how our pelvis moves. It rotates forward and back to help us gain mechanical advantage while we move. So very common for people with sciatic issues to have pain when they walk or to elicit those nervy type symptoms that we were talking about while you're active, standing especially. Sitting is another thing that can compress in here, and that's going to lead us to some of these muscles around the hip here that we would try to do something like a manual release technique, whether that's a pin and stretch. Dr. Andy does a lot of active release technique. Everybody in the office has their own specific type of tools that they like to use to release the muscles, but either way, we know that we need to decrease the stress on the muscles so that it stops compressing the nerve. Because as soon as that nerve gets compressed, it's going to lead to pain. So we got adjustments, we've got soft tissue releases, and then the third, probably the most important thing, is we need to get this motion back in here, an active motion. That's what we're going to get from doing corrective exercises, whether that is activating our glute properly, potentially and most likely also engaging the core in the front of the body so that we can balance out the pelvis from the forces pulling in the back and the front of the body. And also rotational capacity, like we talked about. It's not just going to be rotation of the pelvis, it's also going to be the rotation of our torso, like as if we were walking and rotating towards the front leg. If we lack rotation, that's going to put a lot of stress on those nerves. That's going to cause buildup of scar tissue in areas that could potentially pinch on those nerves, and overall it's going to reinforce bad habits and potentially even bad movements, and what we need to do is correct that stuff before it proliferates into an issue. So we've got sciatic nerve pain, now we know where it is, how it affects the body, we've got a couple different options on how to treat it. If you guys need any more information or you have any questions, feel free to call the front desk at Head to Toe.